The very first person who you will meet, I've sort of gave you a sneak preview of him already. He is Mr. Aaron Phillips. He is the Chief of Staff of the License Collector's Office. Aaron has a very reputable and strong reputation in the banking industry. He was a part of the very first African American bank that we had here in St. Louis, Gateway Bank, and he went on to take those talents with even bigger regional and function on a regional level with many employees who reported to him. And we have been very fortunate to have him as the Chief of Staff of the Office of the License Collector, who oversees day-to-day activities, ensures that we are offering you the very best in customer service. Mr. Aaron Phillips.
Good morning. I'm happy to see you all here this morning. And my portion will be brief, but I want you to know that each one of you are very important to the city of St. Louis. You not only pay your taxes to us, but I just wanted to give you an idea of where your taxes actually go and what you do by paying those taxes and allowing certain things to happen throughout the city. Approximately about 60% goes to the general fund, which provides services such as police, fire department, those sorts of things. So that's where some of your money goes. Another portion goes, a large portion goes to St. Louis Community College. So you're providing education for various students across the city and the state. Another portion goes to the Convention and Visitors Commission, and they actually bring different conventions here that produce more money for the city of St. Louis. They bring events such as the Church of God in Christ convention that was here, the technological conventions that appear at Sabbath Center, and several others that appear throughout the city of St. Louis. So that's where another portion of your funds go. Some of those funds come from your graduated business licenses, and some come from the hotel and motel businesses that operate in the city of St. Louis. Another portion of your funds that come from the manufacturing section goes to the Zoological Society, the Community College District, the Commission on Children and Service Fund, and mental retardation and developmental disabilities. So therefore, you're providing a number of different services to the city of St. Louis, and most people don't even realize that you do so. A very small portion, I'd say approximately about 4%, goes to the Office of the License Collector to provide services that we render to you, such as the licenses and the services that we provide. So you see a very small portion of the taxes that we collect actually go to the license collector's office itself. So what I'd like for you to do is give yourselves a hand for all the services that you provide to the city. So, but I wanted to make sure that you realize where your money goes. With that, I'll turn it back over to Charlotte. Thank you very much for coming.
Okay, the next person I would like to introduce to you is Reverend Dwayne Birch. He is a member of our field service staff, one of our newer members. Very pleased to have him in the office. He will give us the honor of introducing our license collector for the city of St. Louis. Reverend Birch.
Good morning, everyone. Ms. Mavis T. Thompson, Esquire, obtained her Bachelor of Science degree in Nursing and Juris Doctorate from the University of Missouri. She is also a graduate of the John F. Kennedy School of Government program at Harvard University. Thompson is a past president of the National Bar Association, leading lawyers and judges worldwide. Her legal experience includes Assistant Attorney General in the Medical Fraud Control Unit, Senior Associate Attorney in the Health Law Practice Group at Sandberg Phoenix PC, and most recently, she served on the State of Missouri's Division of Employment Security Appeals Tribunal. On October 11, 2013, Governor Jay Nixon appointed Thompson as the St. Louis City License Collector. Thompson again makes history as the first African-American female to serve the city in 2 different citywide elected offices, having also served as circuit clerk for the 22nd Judicial Court. Please join me in a rousing round of applause to receive my boss, the St. Louis City License Collector, Ms. Mavis Thompson.
Good morning, everyone. My role on the agenda is to actually give you a little bit of a history about the Affordable Care Act. When I was president of the National Bar Association, we were charged with the task to review the act and also give talking points for the Congressional Black Caucus. And so it was very timely because of my background also as a nurse that we were able to provide those talking points. And I want to share some of those things with you today. First, what is the act? It's been called by many names. The act is officially called the Patient Protection and Affordable Care Act. And as we know it, it's commonly known as the Affordable Care Act, as well as Obamacare. And so when we hear any of those, they're synonymous. On March 23rd, 2010, it was signed into law as a federal statute. And that's really important when we think about it, because when we talk about the hierarchy of the laws, federal statutes are way up there. So it's a federal statute, and it was signed into law by President Barack Obama. Now, on June 28th, as you know, although that it was signed into law, it had many, many legal challenges. And so it went all the way up to the Supreme Court, one of the challenges. And so on June 28, 2012, the constitutionality of the act was upheld by the Supreme Court. And we'll talk about that a little bit later, and I'll give you some case precedent for lawyers that are sitting in the room. Thank you, Hope, for joining us. The provisions were scheduled to take place, they started taking place in 2010 and will continue until 2020. Oh, Khalifa, I forgot my clicker. Oh, here it is. Oh, I got the clicker, okay. All right, now, the Affordable Care Act goals. 3 primary goals that we had was to increase the quality and affordability of health insurance, lower the uninsured rate by expanding public and private insurance coverage, and also to reduce the cost of health care for individuals and the government. So those were the primary 3 goals of the act. The Affordable Care Act, some of these significant reforms. And first we'll start off with the guaranteed issue. Fancy name for prohibiting insurers from excluding those or providing coverage for those that had pre-existing conditions. Really very, very important piece of legislation. You cannot be excluded from coverage if you have a pre-existing condition. Now, what is the individual mandate? It requires all individuals not covered by an employer-sponsored health program, Medicaid, Medicare, or other public or private insurance program to insure and secure an approved private insurance policy or pay a penalty. And so again, trying to get all those that are uninsured to be covered by some sort of health plan. Now, there is a caveat and there is an exception. Unless the applicable individual has a financial hardship or is a member of a recognized religious sect that is exempted by the Internal Revenue Service. And so when we talk about the religious sect, we have to go to the IRS codes to determine what those exemptions will be. Now, healthcare exchanges. The intent was that healthcare exchanges would be commenced in every state. Again, I preference that by saying intent. And each of these exchanges would serve as an online marketplace where individuals and small businesses such as yourself could compare policies and buy insurance and receive some sort of government subsidy. That was the intent. We all know that that did not happen here in the state of Missouri. We'll talk about that a little bit later. So the business employer mandate, and I'll just read this. Businesses which employ 50 or more people but do not offer health insurance to their full-time employees will pay a tax penalty if the government has subsidized a full-time employee's health care through tax deduction or other means. Now, big mouthful, I'll let the other panelists, they'll explain that fully, just giving you kind of an overview of the history. Now, let's talk a little bit about what happened here in Missouri. There is a state opt-out of the Medicaid expansion. So we'll start with some historical data. On November 6, 2012, there was a ballot measure right here in Missouri. And Missouri voters passed the ballot measure that blocked Governor Nixon from establishing an exchange via executive order. The legislation establishing a state-based health insurance exchange was filed in both 2011 and 2012 legislative sessions. Accordingly, here in Missouri, our online exchange is not operated by Missouri, by the state, it is operated by the federal government. Now, how do we get there? On June 28, 2012, the United States Supreme Court upheld the constitutionality of the ACA individual mandate. And again, it was an exercise of Congress's taxing powers. The case was National Federation of Independent Business versus Sebelius. Now, in this case, the court held that the states cannot be forced to participate in the Act's Medicaid expansion under penalty of losing their current Medicaid funding. And so Missouri opted out. We only took a small portion, we were only allowed a small portion of the subsidies that the government provides to implement the Affordable Care Act. And so we lost out on millions of dollars here in Missouri because we opted not to go with the health care exchange here. And let me just give you another example. Missouri declined to expand Medicaid or to establish a health exchange marketplace. They even enacted a statute forbidding any state or local official to render any aid that was not specifically required by federal law for the functioning of the Affordable Care Act. So just looking at the historical perspective, and also I ended with an overview of what's happening currently here in the state of Missouri. Thank you very much.
That's pretty exciting. She just opened the door to the discussions that were to follow, but that was a nice historic perspective because we only get news bites. And so we are encouraging you with conferences like the one that we're having today. We want to take you several steps beyond just the myopic piece that you hear. And one such person who's going to take us a little broader has a national reputation for doing this. You know, it's so interesting how the way I had you stand up and introduce yourselves just now, how we take each other for granted. Richard K. Gaines is someone that I've known my entire professional career. I didn't quite know everything that Richard did, but I did know whatever he did it very well. And you will hear Richard as the owner and president of Richard K. Gaines, Inc., one of the largest African-American owned commercial insurance firms in the United States. He's recognized as an expert in his industry. Richard Gaines has been called upon to serve as a professional consultant to countless organizations and even high-ranking places like the White House. Richard K. Gaines is past president of the St. Louis Board of Education and currently serves on the 3-person Special Administrative Board that governs the St. Louis Public Schools. He has also developed and implemented one of the most successful surety support programs in the United States. We are very fortunate to have his voice to weigh in on this issue of affordable health care this morning. Richard Gaines is also a certified broker for the Affordable Care Act. Richard Gaines.
Well, I got to hire that woman quick. How many of you are from the state of Illinois? Your business is domiciled in Illinois. None of you? Because you're here on the border, it's possible that that some of you may have been actually domiciled in the state of Illinois, but for reasons of commerce, you'd have to do business in Missouri or the city of St. Louis. Consequently, you need a license through the license collector's office. Let me mention a few things first. We've been in business for 30 years here in the city of St. Louis, continuously. We have, and I'd like to thank the license collector's office for including us this morning in some brief comments to you. You've heard all of the problems associated with the ACA. The computers don't work. People, I heard a gentleman coming up on the elevator today saying, this thing is going to cost me more than I'm going to save. It's a mess. It really isn't. I'll tell you some things, though, that are challenges from the industry standpoint. You know, we've been selling health insurance for over 30 years. Over 30 years. This act is purely a matter of the sale of health insurance. Now, the difference is there are some structured plans that are somewhat different. One of the issues the license collector mentioned is a whole question of guarantee issue. We're not used to that in this country. We're used to having someone say to us, what kind of health do you have? And if your health is not very good, you may either be rated up or declined. That goes away. We tend somewhat to forget some of the advantages that are brought to this economy and the United States by what we term, we term Obamacare. Let me give you something real quick. Universal health coverage for a country is not new in this world. This country is one of the last in the industrialized societies to adopt it. But we are also the first major company not to deal with a one-payer plan. Now, you will hear people talk about a single-payer plan. What that is the same thing as you know now as Medicare, okay? It's really no difference. One payment, one company pays for everything. In the case of Medicare, your basic Medicare coverage is all provided by the federal government. What has been done with this program so that private industry would have a role in it is that you have a multi-player plan, which means that more than one company, quote, the government, provides, theoretically, a competitive marketplace, because we are a country, an economy based upon competition, okay? Now, it sounds like it may be very, very difficult. People who are not geeks find trying to enroll really, really cumbersome. If you were an individual, we were doing some issues in my office with some people who were getting certified last week, and the site there went up and down. There was a problem with that. The Missouri Association of Independent Agents just sent out a fact sheet to us who are members just day before yesterday, talking about the problems that were associated with agents those agents who want to provide this service, getting on the website. Let me remind you, when Social Security was instituted in this country, we did not have a website, or we didn't have the internet. There were huge problems associated with the implementation of Social Security. When Medicare was developed, there were huge problems associated with implementing Medicare. This is actually no different. We have made a living in the industry of insurance to a substantial degree by being able to do things that either people chose not to do. In some of our cases, it's insuring things in the city of St. Louis itself. And also by getting an understanding and trying to translate that understanding into non-technical terms to people who need services that we provide. Now, let me give you some very structured, simple things. The sale of health insurance is not new. All of you know that. You're business owners, so you know that. We do that. This is simply just for us pretty much the same as adding a new company or a new benefit structure. It's the same. We are not just, you hear the word certified. In states other than Missouri, that is causing all kinds of problems with people who are, quote, certified, who are attempting to sell insurance, who know absolutely nothing about it. To become certified, give you an example, you spend 4 hours on a computer to get a certification from the federal government. To become a licensed agent in the state of Missouri or Illinois, in which we are licensed in both, to your primary license, you spend 40 hours in class. You spend 16 hours every 2 years with continuing education credits, okay? Now, I want you to think about people initially were going to be trained for 4 hours to advise people what insurance plan they should take. Insurance plans and companies change yearly, and you have to stay abreast of that. Many of the people initially had no background checks, and there were serious problems. Well, much of that has been worked out and is being worked out. What we'd like to leave you with this morning, and my colleague will come shortly and explain this to you, we'd like to leave you with the fact that this is not the great, humongous problem that in many cases it's been identified as. Ladies and gentlemen, we're doing the same thing we've been doing for 30 years, simply selling insurance. Now, because I have to always talk about the sale of insurance, because that's the way we make a living, you'll find some calendars over there, some beautiful calendars. But I want to tell you two things. Take one only. If you want more than one, call us. We'll come and sell you some insurance, and we'll then give you as many more as you'd like. On the front of our calendar, you will see the picture of a gentleman by the name of Obama. Now, I'm not political. I sell insurance to Republicans, to Democrats, independents, everybody. It just so happens that this calendar we have bought now for the last 4 years. This year it comes with the president's picture on the front. Some of my more conservative clients have had to say, now look, don't judge me by your politics. Judge me by what's in the calendar. The calendar, we believe, and I've given them to St. Louis public school students and students all over this area, we think is one of the most factual and most important calendars you can have. Every year there's a month that people talk about African American History Month. This calendar lists out a significant event in the lives of African Americans every day. So you understand that as a part of the fabric of this country, African Americans are part of that fabric. It's a wonderful way, and this is not just for black folk. The people who love these calendars more are white folk who never get a chance to understand the importance of the culture as it intermingles with the culture. So please take how many calendars? Thank you so very much. I'd like for my colleague, who I've known now for about 10 years, and is our technical expert on Obamacare, and I believe will answer most questions you have at the appropriate time, to come forward now. Rick. Rick Gary has been associated with us for a number of years and is really a recognized expert in the areas of Obamacare. So I'll leave it to him. Yes, I'm certified and I'm licensed. We all are. I know a little bit more about it than probably more than you, than most of you. But here's the guy that we go to for our questions on Obamacare. Thank you.
Good morning. How you doing? What lawn care are you with? Okay. I thought you said T&T. My lawn care. Good morning. Some time ago, first, speaking of history, now, I'm a history buff, and on my Facebook, I post on this day whenever I get a chance to it. On this particular day, in 1903, Orville and Wilbur Wright flew their plane off the plains of Kitty Hawk, North Carolina, ushering in powered air flight. Also on this day, a African American was born that I am very close to. That's me. So this is my birthday. When I first got, I'm an engineer by trade. When I first got in the insurance business, the person teaching me, training me, told me, when you go into a client's office, they want to know only three things: who are you, what do you want, and how it's going to benefit them. So you already heard what it is, Obamacare, and you've already heard who are we. And now, very briefly, I'm going to try to tell you how it's going to benefit you. If you're a small business owner, they talk about guaranteed issue. Guaranteed issue really was for small businesses were back in HIPAA, back in the Clinton day when they HIPAA. Small business, if you're a business owner, you're a guaranteed issue then. It wasn't guaranteed for individuals. So the individual mandate guaranteed issue, that will come January 1, 2014. If you're a small business owner, I'm going to talk two things: small business and individual, because some individuals are small business as well. What the ACA does for a small business, first of all, it will now give you a tax credit if you qualify. I think 25 full-time employees or less, average salary of $50,000 or less. You now qualify for a tax credit, not just a tax deduction, but a tax credit if you provide benefits to your employees. You have to pay at least 50% of the premium cost. I don't know why they put that in there, because a group insurance company will not sell your product unless you pay at least 50% of the cost. So, but you got to pay 50% of at least the employee costs. The shop. You heard about the shop, the exchanges. Shop is for the businesses. The exchanges, I think, is for the individual. What the shop does for you, it's a way for you to compare plans and prices. As a technical guy, because there are fewer plan designs on the shop plan, the prices may be lower. However, from my actuarial background, premium is a function of cost. Cost is not a function of premium. Consequently, when insurance companies set their premium, what they're setting is based on the claims that they have to pay out. Something else in the ACA, something called MLR, medical loss ratios. Kind of interesting. This kind of took place a couple of years ago, kind of hit on the radar screen, except for people who actually have health insurance, group insurance. It says that if you are small employers are defined right now from 2 to 50 life, small employer. And also individuals. For every dollar the insurance company takes in premium, they have to pay out 80 cents on that dollar. So some people got some people got checks back from the insurance company. Never got checks back from the insurance company all their life. So, and what they were doing, the reason they got those checks back is because the insurance company collected more. They paid out less than 80 cents on the dollar they took out. Large group, every dollar they take in, they got to pay out 85 cents on that dollar. So they got back, some of the large groups got back refund checks. So that's how, briefly, that's how it will benefit small groups. Individual, massive change. On the group side, you're already guaranteed issue. You're going to have a place to go shop now for some standard plans. You also get the medical, you get loss rate, you get some refunds back if if the insurance company takes in more than, pays out less than 80 cents on a dollar. Again, the premium. Individual, massive change, because individual now guaranteed issue. Not only are they guaranteed issue, you also have subsidies. If you own a company and you have part-time employees, and let's say you have that's a restaurant, and you right now part-time employees really are ineligible to be on a group plan. It says that on the contract. If you ever read the the employee application, it says all eligible employees, all full-time eligible employees. Doesn't say part-time. Part-time employees are ineligible. However, now part-time employees can actually go on the exchange, get an individual health plan that's guaranteed issue, and also be subsidized. And it depends on how much money they make. I use a rule of thumb. If someone is making $30,000 or less a year, and I'm gonna just rule of thumb, their premium for the silver plan is $50 a month. It could be a little bit lower, a little bit less. That's an individual. That's highly affordable for somebody making $30,000 a year. And not only are the premiums subsidized, the out-of-pocket exposure. What out-of-pocket exposure really means is kind of a, I'm not even sure the technical term. What it really means is, I'm looking. I want to know how much time I got. 5 minutes, okay. I forgot about that. What it says is, if you go to, in a calendar year, if you have big claims, how much money you have to pay out of your pocket. The subsidy also caps how much money you have to pay out of your pocket. So back to how does it benefit you? Small business owner, two lives, 26 lives, 2 to 25 lives, average salary $50,000 less. Not only do you get a tax credit, not only do you get a tax deduction, you also get a tax credit for providing benefits to your employees. So there are businesses that have been providing employee benefits for their employees for, since you've been in business. But you have to be on go on the shop exchange to get the credit. So now you're going to shop exchange, and the benefit will pretty much be about the same. The bronze plan, the gold plan, the silver plan, the bronze plan, silver plan, gold plan. Now you get a tax rate. That's money in your pocket. Those dollars in your pocket. Individual, depends on how much money you're making. You guaranteed issue, but also you can receive a tax, a subsidy for your premium, also a subsidy for your out-of-pocket benefit. I welcome to answer any questions you have, and I think if I may be a little early, but that's okay. I better believe early than late.
Moving right along, we're going to go now to Mary Timmo. Mary has spent years as a health care advocate. She currently is the Midwest Outreach Manager of the Small Business Majority. Mary builds relationships with small businesses and organizations through listening tours, webinars, and panel discussions like this centered on the affordable health care. Prior to joining Small Business Majority, Mary worked with Alliance for Climate Protection, building support from individuals and businesses for clean energy and legislation. She is a natural advocate, and we appreciate her taking the time to join us today.
Thank you so much. A lot of the information we cover has been hit on already, so I might move through the slides a little bit quickly to get to the parts toward the end and dig a little more in depth about what we've heard. So we'll start a little bit. Small Business Majority, we're a national nonprofit small business advocacy organization, and we're not a membership organization. We base our advocacy on research and data and polling. Among a number of other issues, we're focused on healthcare. It's my primary focus here in Missouri. We've added additional staff members for the coming changes and educational tours across the state. So we had already talked about this, but as we talked about the history of the Affordable Care Act, one of the things they really wanted to address is that healthcare had become unaffordable for small business owners. They're paying about 18% more than large companies, leaving about 28% uninsured. So there's a lot of incentives in the ACA for small businesses and very little requirements. And so it's not a surprise for all of you, but we like to put that in context of why the shop came about, why there's these protections. We had done some surveys. About 70% of small business owners who aren't offering coverage don't offer it because it's unaffordable. It's not because they don't want to. It's not because they don't understand what kind of a powerful recruitment and retention tool it can be. It's because they can't afford it. Of those, 72% of the ones that are offering are struggling to do that. So we'll hop right into, we covered a lot of this. It builds on our existing healthcare system, so it isn't a complete overhaul. It was upheld by the Supreme Court, and we're gonna hit on some of the benefits that are in effect right now. One of the portions of the ACA that's a little bit under talked about, but we think it's important to talk about how people are, up until this point, were locked into their careers, sometimes based on their ability to access health care. So the provisions that we've discussed already with not being able to deny coverage for pre-existing conditions or allowing people to access coverage when they've had health issues will free up a lot of people to make the decisions that you've all made, to be entrepreneurs, to move forward and to start those small businesses. We talked about pre-existing conditions. There's also a ban on lifetime caps. So people who do become ill will no longer hit a point where their insurance company says, we're not paying out anymore. They don't have to worry about reaching those artificial limits that were set prior to the ACA. Adult children can stay on their parents' plans up to the age of 26, allowing more ability, if they're struggling to get a job or they've been offered a job that doesn't offer health coverage, they can still access that coverage if their parents choose to allow them to stay on. So first dollar coverage for preventative care for all new plans. So plans will have access to diagnostic testing, some cancer screenings, diabetes testing. So really looking at maintaining the health of people who have health insurance and have gained access to coverage under the ACA to keep them healthy rather than just addressing the issues when they become ill down the line. So these are sort of those patient protections portions that were talked about earlier. But let's talk about the SHOP and the tax credits, small business owner specific issues. So there are two marketplaces, like was mentioned earlier. There's for individuals and families, and there's for small employers between 2 and 50. So the tax credits actually went into effect back in 2000 tax year 10, and you can amend your taxes back. So this is the second time you've heard about them today, but we really want to let you know that if you figure out that you were eligible, if you fall into those guidelines of under 25 full-time equivalent employees with average annual wages less than $50,000 a year, you can look at your taxes and amend them backward if you had missed out on those prior to hearing about them today. About 92% of all Missouri businesses can be eligible for some form of this credit, with 25,000 eligible for the maximum. So the maximum credit, we'll skip past that one. The maximum credit of 35% between 2010 and 2013 was reserved for businesses with fewer than 10 full-time equivalent employees, average annual wages less than $25,000 a year, with that same employer paying 50% of the premium cost. So a full-time equivalent employee is someone who works or a full-time employee is considered 30 hours per week. Part-time is 15 hours per week. So when doing the number of staff you have, you're calculating for full-time equivalency. So 2 part-time staff roughly equals 1 full-time. Moving forward in 2014, you see the maximum credit goes up. That's for plans purchased within the SHOP. So if you want to access that, as was mentioned, you do need to go through the SHOP to access that, but the credit is increased. It's for any 2 consecutive years. So when you start accessing it, if you choose to do so in 2014 or you wait till 2015 or 16, it's for 2 consecutive years once you've started accessing that credit. For the nonprofits, I heard 1 or 2 mentioned. You are also eligible for a tax refund. The percentages are slightly different, but you can still look into that. Same employee number and salary requirements apply. We offer a quick, really basic example of this, but this is just to show how that full-time equivalency could affect your business. So you could be above that 25, but if they're part-time, you're calculating that full-time equivalency of your employees. New tax form, you can find it on irs.gov. I'll let you take a look at that. And moving forward, so getting into the SHOP, we've touched on it briefly. It is private insurance plans competing for your business, so it isn't a government plan. It is open. There have been a lot of discussions about delays in different portions of it. Those have happened, but the SHOP marketplace is up and running. You can enroll through your broker, you can enroll directly through the insurer website, you can enroll on paper, so you are eligible to do so. There's just been a delay in the online enrollment, and that's a full year delay. So that won't be, it's up and running next November. So up until then, you're purchasing through those traditional channels, much like was talked about before. You know, there's changes in the ACA, but it is still insurance. You can still access it through the licensed agents and brokers, or you know, you can go on to healthcare.gov still, and you can still look at those plans there and make comparisons and make decisions. Just when you purchase, you'll purchase it not through the healthcare.gov website, so that won't be where you pay. So enrollment did begin October 1st. If you want your coverage to start by January 1st, 2014, you do need to enroll by December 23rd. So right around the corner is that first deadline if you want that coverage to start January 1st. Enrollment's not ending, but that's the deadline if you need your coverage to start on the first of the year. So we talked a little bit about the tax credits for small businesses and individuals. For individuals, those within 100 and 400% of the federal poverty level, if they purchase through those individual marketplaces, they also have access to affordability credits. So looking at sole proprietors or people who aren't able to access care in another, or insurance in another way, you can get that, you can get affordability credits through that. So in Missouri, the SHOP marketplace has two carriers out of the Kansas City area. They have Kansas City Blue Cross Blue Shield. Here in the St. Louis area, they have Anthem. So there's a couple of examples on here. These are just brief, basic examples. To get a good look at those plans, you would need to, you know, go through the healthcare.gov's website, ask your insurance agent or broker. These are just the example plans of what's out there for you. If you see the bronze, silver, and gold, and it was mentioned before, that's the percentage of cost that the plan covers. So all of the plans on the marketplace at least cover 60% roughly. There's a few, you know, as you work it out to enroll in the plans, you'll find out a little more about that, but they all cover at least roughly 60%. Silver is 70, gold is 80. We don't have platinum in Missouri, so as you hear people talk about that, it's just not something that's up and running on our plans yet. The individual actually has an additional choice in the St. Louis area of Coventry being another option for you. So of course, when you look on those, you want to look at the networks, you want to look at the deductibles, but you can investigate for the individual marketplace. You can investigate all that on healthcare.gov, and you can actually enroll through that website. So those of you looking to just enroll yourself, that same December 23rd, if you need it to start January 1st, and you can enroll right through the website. So anybody in here with a business with more than 50 full-time equivalent employees? Okay, so we'll hit a little bit on the employer mandate part of the conversation. But if you take a look, one of the reasons why the Affordable Care Act, you know, has the employer mandate, it affects a small amount of large businesses. They're already providing that coverage. They understand what kind of benefit that offers and what kind of recruitment tool they can use that, and they're able to afford it a little more than small. So it applies only to large employers. It has been pushed back till December 2015. So large employers have more time to look at their staff, make their adjustments, make their decisions on how they want to offer that coverage or what they want to do and change. So businesses with fewer than 50 full-time equivalent employees, which is the rest of you in the room, judging by your hands, are under no obligation to provide coverage. So we like to clear that up and hit a little bit about that. In looking at you, if you are close to that 50, if you're above or below, again, a full-time employee under purposes of the ACA is 30 hours per week. So part-time is 15, and then seasonal employees are people who work less than 120 days a year. And there's a few more calculations around that. This is the general description. We have a frequently asked question on our website and a couple other tools to help you calculate that. We also have some handouts that run through that as well. This is the basic calculation for you. So if you are a large employer, over 50 full-time equivalents, and you're failing to offer coverage, there are a few penalties associated with that, much the same way that individuals who are deemed able to afford coverage are required to pay a penalty. Businesses are as well if they fall into those requirements. It's $2,000 per employee, but you subtract the first 30 from that. So if you had 60 full-time equivalent employees, you would do that on a basis of the remaining 30. For those that have, they fail to offer affordable coverage that provides minimum value, that means that the coverage is more than 9.5% of the employee's household income. So if you want to do a simple calculation, you could base it on the wages you pay the employee for the individual coverage. So if it doesn't meet that affordability requirement, and minimum value means where the plan pays at least 60% of the premium cost, those employees would be able to access affordability credits through the marketplace, and the penalty for the large employer would be based on the number of employees that took that option. So there's two different things that large employers are looking at, but again, it's in 2015, so it gives them time to make those adjustments and make those calculations. So moving forward, individuals can enroll online, purchase coverage for their families, look at those bronze, silver, and gold plans and options. Small employers have that same opportunity. All plans, and this falls under that patient protection part that was talked about earlier, cover the same 10 essential health benefits. So people won't have to look at the plan and make sure that it covers ambulatory care, or they won't have to look and make sure that it covers maternity care, or for children, make sure that it covers dental and vision. Those things are all going to be covered, and the plan descriptions will be in plain language. So while it's still purchasing insurance the same as you've done before, they're also working to make it a lot easier to understand what you're getting when you purchase that insurance, and make sure that these 10 things are covered so people don't have an accident or have an incident and discover that the issue they're looking at isn't part of their health coverage. You are all able to make sure you have those 10 essential health benefits. Individual responsibility and shared requirement. One of the things we do also want to highlight is because Missouri did not expand Medicaid, people are going to fall into a bit of a gap where they don't go up to that 100% federal poverty level, and they aren't able to access those affordability credits. People who would have been able to get Medicaid had we expanded aren't going to be penalized because they aren't able to access coverage. So it is, there are people who are going to be at 80 or 90% of the federal poverty level, look at those exchanges, not be able to get those affordability credits. They don't have to worry about paying that penalty. So we want to be clear about who it affects. It affects people who are deemed able to afford coverage and are choosing not to do so. So, low-income individuals who don't file tax returns, or people who fall in that Medicaid gap, and the other ones that we talked about. But we want to be clear for those folks who are struggling at that Medicaid, if they're right around that area, what it means for them. We've hit on a lot of this, so we'll move past in interest of time. We have an example, but the Kaiser Family Foundation offers a calculator where you can put in a sum of your facts, take a look at it, see where you feel like you fall on that. I also am happy to share these slides with anyone. If they want to share their information, we can email these to you so that you have this information right in front of you. One thing, most small employers are required by the Fair Labor Standards Act to notify their employees of their coverage options. So there was a deadline for this of October 1st, but the Department of Labor has made it clear there's no finer penalty if you hadn't done so, if you didn't know about this. But moving forward, you need to notify your employees either if you are providing coverage or aren't, and there's a form you can print out on the Department of Labor website and just let them know where they're at. And then anytime from now forward when someone's hired, they do need to receive that form just to let them know their coverage options. So it's either, if you are offering coverage, or to let them know, basically, as an individual, we're not offering coverage, here's your options, some things that are out there for you. So it's just a formalization of a conversation you probably all had when you hired people in the beginning. It now has an additional form with it. Couple of deadlines. The individual marketplace does have an open enrollment deadline of March 31st. Shop enrollment is ongoing. So if you're looking to enroll in the shop as a small business, that is ongoing throughout the entire year. Individuals have till March 31st, and then the next open enrollment period is in November 15th, 2014 into January. So as you hear about deadlines, one of the things that the news coverage around this issue often does is just says marketplace. They're not specifying which one. So as they talk about open enrollment deadlines, that's the individual marketplace. If you're looking in the shop, you have ongoing enrollment throughout the year. We have a Missouri Health Coverage Guide and information for employers who, if this is your first foray into the insurance, you're not sure what you're even supposed to be asking or what the next steps are, or you're a little more advanced and want to look at details, we have a step-by-step guide that'll walk you through that process on our website. Healthcare.gov, again, is where individuals can enroll and small employers can look at those plans and make a decision, and then go through those traditional enrollment channels that they've always used. And a few more resources, and in the interest of time, I'm going to turn it over to Jeremy, and we're happy to take questions at the end. Thank you.
I'm proud to introduce to you now Jerry Midlarski. He is the program manager of Primaris, which covers the Missouri area for hospital and health care. This is a very impressive program. It's a federal contracted program for over 30 years, and it's one of 2 organizations in Missouri to receive federal funds to provide one-on-one counseling for the health insurance marketplace, and the only organization to receive funds from both major funding sources in the state for this work. So you have just all of the experts here today from the private, commercial, as well as our nonprofit sector, and now we'll bring Jeremy.
Salus populi suprema lex esto. The health of the people shall be the supreme law. That is the official motto of the state of Missouri. And it is one that is fairly poignant when we're talking about the topic today. I'm going to cover 2 main points, because a lot of the finer points about this law have been covered by the other experts. One is why we're doing this. Why is this important? If you look at the census figures for the first decade of the 21st century, and you rank all of the states by the percentage increase in uninsured people, Missouri normally, in most state rankings, appears in the middle, maybe a little closer to the bottom. In this one, we appear at the top. The percentage increase in uninsured people was higher in Missouri in the first decade of the 21st century than it was in any other state in the Union. And we all pay for that. $1.3 billion cost Missouri hospitals in 2011 in uncompensated care. That figure is expected to go to more than $3 billion by 2019. It's an unsustainable system. If coverage is not expanded, the system will collapse in on itself. We're not a partisan group. We're a nonprofit. We've been contracting with the federal government for 30 years for various topics in the healthcare space. We're not out to sell any policy, and we're not out to sell any law. What we do is help people understand these benefits and understand how the law affects them. So I'll give you another number. If you take 5 people, 5 Missourians, who are eligible for the marketplace, who don't otherwise have access to affordable insurance, 2 of them, after subsidies, have at least one plan available to them that costs them $0 in premiums. 0. Think about that for a second. There's about 40 people in this room. So assuming all of you are eligible for the marketplace, none of you have access to Medicare, TRICARE, affordable job insurance in your household. 16 of you have a choice. If you don't get sick, a health plan that costs you 0, or you pay a tax penalty for no insurance. You have the deductible, of course, with any health insurance policy, and we had a couple questions about deductibles that we'll get to later. If you have no health insurance, your deductible is infinity. The average sprained ankle in a hospital emergency room in the United States costs about $20,000. That's more than the top allowed out-of-pocket limit for any policy on this market. The federal government sets those out-of-pocket limits every year. It's a lot less than $20,000. People see the deductibles and they get very upset, but you have to consider the average hospital cost as well. We run a program that is more or less statewide. We're in key areas of the state. We have 2 partners here in the St. Louis area. One is the Oasis Institute, which is based at Barnes-Jewish Medical Center. The 3 hospitals, there's the main one, there's one in West County, and there's another one. You can go onto our website, primaris.org/counseling, and find out where they are. We have another partner in the St. Louis area known as Bilingual International Assistance Services. They're on McLind Avenue here in town, and they specialize in translation services. So if you have people who are interested in this and maybe English isn't their first language, then the folks at BICE can probably help you. This is a system that lends itself to deliberation and investigation. This is not easy stuff. Health insurance is personal, it tends to be complicated, and it tends to have a cost, particularly if you don't have it. And so this is the time, we think, to sit down and look over your options. Because even if you're not a fan of this law, and a lot of people aren't, then it still makes sense. It might make economic sense for you to look at your numbers. A lot of people don't like income taxes either. But they sit down with an accountant or a calculator and look at their budget. You don't want to leave money on the table that's legally yours. You know, think about it. You probably know somebody, waiters, daycare workers, artists, who have that choice. Basically free health insurance, or a fine and no health insurance. A fine and no health insurance, and the possibility of a catastrophic incident that's going to put them in the hole for most of their life. This is not politics. This is practicality. This is common sense. There are a lot of experts in this room. We represent various organizations. Some of you are comfortable with brokers. I encourage you to sit down with them. I encourage you to sit down with them and look at your numbers. See if this makes sense for you. See if this makes sense for your employees. For some of you, the shop marketplace will be a good fit. For others of you, maybe you're self-employed and you have a workforce of one. The individual marketplace might be the best fit for you. But to sit down and close your eyes and cover your ears and say this is socialism or something like that, it doesn't make sense. Okay. In our coalition, we are committed to protecting your private information. Again, we're objective. We don't sell any policy. We don't sell any law. If you're mailing an application, we don't mail in your application for you. You do that. We don't keep your personal information. You know, I guess I'll close. We do want to get to the question, so I'll keep mine rather short. There are calculators to help you if you wish on healthcare.gov. You don't have to go ahead and create an account and jump through the rabbit hole of healthcare.gov. There is a find plans tool, and as of Monday, it allows you to actually calculate what your subsidies might be. And it actually, for some people will qualify, Rick actually mentioned this, for reductions in your deductibles and reductions in your out-of-pocket maximum. The calculator now does that. So let me kind of quantify that for you. A lot of this depends on your relation to the federal poverty level. So the federal poverty level for one person is about $11,000. If you're between the poverty level and 4 times the federal poverty level, you'll get some kind of help paying for these plans, paying for your premiums. That's about 6 in 10 Missourians, 6 in 10 uninsured Missourians, excuse me. If you make between $11,000 and $17,000, you'll get some kind of help with your deductibles as well as with your premiums. So the deductibles on the exchange tend to be fairly high, but if you're in that category of between 1 and 2.5 times the federal poverty level, you get some relief from that. And I guess I'll close again by bringing it back to the original point, which is this is something that requires deliberation. We've dealt with a lot of clients. People ask me a lot, well, how many enrollments have you had? How many sign-ups have you had? Well, it's not about enrollments for us. It's about how many questions we answer and how many people we help. I visited with a veteran who just came back from Afghanistan a couple of weeks ago. He had Medicaid questions. I was happy to answer them for him. That wasn't an enrollment. Okay. We have helped more than 1,500 Missourians since October 1st because this is a complicated law and we're here to explain it to them without advocating for any policy, without advocating for any insurance company. Okay. All right. I thank you all very much for coming on this cold day.